Good afternoon, everyone. Okay, today's lecture is about the extraction forceps. My name is Ahmed Al-Marashi. I'm a lecturer at the University of Basra, College of Dentistry. I hold an MSc degree in oral and maxillofacial surgery from Manchester. So, in the beginning, what are the extraction forceps? The extraction forceps are instruments that are specifically designed for removing the teeth from their sockets. The extraction forceps can be used for delivery of previously luxated teeth and should never be used for pulling of the teeth out of their socket. So in the beginning, we need to luxate the teeth, and then we can deliver those teeth with the extraction forceps. By using the extraction forceps, we can widen the alveolar bone, destroy the periodontal ligament to aid in the delivery of the teeth, if we use those instruments in controlled forces. The components of the extraction forceps are the handle, the hinge, and the beaks. The handle is the largest part that forms this instrument, which is be grasped by the operator, by the dominant hand. Sometimes we have like this serrations on the side of the handle to allow positive grip of the instrument and to prevent its slippage. The next part is the hinge, which connects the handle to the beaks and transmit the forces the operator gives to the instrument through the beaks. Last part is the beaks of the extraction forceps, which is the part that is applied on the target tooth. The beaks are different from one forceps to another depending on the anatomy of the tooth to be extracted. There are different types for extraction forceps. We have a maxillary extraction forceps and also mandibular extraction forceps. The maxillary extraction forceps can be further subcategorized into an anterior extraction forceps, premolar extraction forceps, a molar extraction forceps, and also we have variations of these extraction forceps. The mandibular, on the other hand, the mandibular extraction forceps also can be subclassified into an anterior extraction forceps, premolar extraction forceps, and a molar extraction forceps. And in addition, we have variations for these forceps. Finally, we have a new forceps, relatively new to the others categories, which are the physics extraction forceps. Now we get into more details into each category. The first one category is the maxillary extraction forceps. Starting with the maxillary anterior extraction forceps, these extraction forceps are used for the extraction of the anterior teeth from the left canine to the right canine. So it's used for the extraction of the 6 anterior teeth, central, lateral, and canine, and on both sides. So we have the 6 anterior maxillary teeth. This forceps can be used to aid for their extraction. The maxillary anterior extraction forceps, when viewed from the side as well as from the top, it's a straight extraction forceps. We have the handle, the hinge, and the beaks all in one line, in one axis. If we have a closer look on the beaks, these beaks are smooth and rounded from both sides to accommodate the single-rooted anterior maxillary teeth. The next part is the maxillary premolar extraction forceps. This extraction forceps can be used for the extraction of the first, second premolars on both sides, the right and left. If we view this extraction forceps from the side, we have two curves, one in the handle and another one through the hinge and the beak. This gives the instrument an S-shaped configuration. The S-shaped configuration and the curves of the handle and the beaks and the hinge will allow to accommodate the lower lips and the lower dentition while remaining with the long excess of the first and the second maxillary molars. So we can grasp the premolars without damaging the lower anteriors and the lip within the handle. The beaks are smooth and rounded to accommodate the root trunk of the first and second premolar. The third part, we have the maxillary molar extraction forceps. This extraction forceps is used for the extraction of the first and second molars. It comes in pairs, and each one of the pairs is used for extraction of one side of the jaw. So we have a maxillary extraction forceps for the right and a maxillary molar extraction forceps for the left. The reason behind this is because we have multi-roots of the maxillary molars. So on one side we have a mesial-buccal root and a distal-buccal root. On the other side we have the palatal root. So the rounded beak of the extraction forceps is used to fit on the palatal side, while the beak that have a projection or a hook in the center of it is used to engage the buccal side, to engage the forcation entrance between the two buccal roots. Therefore, we have an extraction forceps for the left and extraction forceps for the right. If we view this extraction forceps from the side, similar to the premolars, it has an S-shaped configuration, also to accommodate the lower lips and the interiors within the handle, and the curve of the hinge and the beak to remain with the long excess of the maxillary molars during the extraction. A variation of the molar extraction forceps is the maxillary third molar extraction forceps. It has a longer handle to allow the reach deep within the oral cavity to know the more posterior position of the third molar. And also we have the beaks set in an offset from the long axis of the hinge and the beaks. So the beaks are an offset of the hinge and the handle of the extraction forceps. This mainly to allow remaining with the long axis, at the same time giving the advantage to reach more posterior within the oral cavity. This is one of the longest extraction forceps of the maxillary arch. If we have a closer look on the beaks, it's rounded and smooth on both sides to accept the wide anatomical variation of the third molar. Sometimes we have a third molar with the forcation entrance and diverge root, and sometimes we have a third molars with a fused root. So to accept the wide anatomical variations, these forceps have rounded beaks from both sides without any hook to accommodate the wide anatomical variations of the third molar. Another variations for the extraction forceps, we have the maxillary cow horn molar extraction forceps. These extraction forceps are mainly used for the extraction of severely carious molars. Their beaks are pointed, long, and designated to engage the forcation entrance of the molar. from both palatal and the buccal side. The maxillary cow horn molar extraction forceps can generate extensive amount of forces during the extraction, which sometimes can lead to the fracture of the buccal bone. So their use is limited during this time. The last variation for the maxillary extraction forceps, we have the maxillary root tip forceps, or sometimes referred to as the bayonet extraction forceps. It has a narrow, long beaks to aid to reach deep within the sockets to retrieve even the tiny small bits of the root tips. Also, the handle are long and the beaks set in an offset from the long axis of the hinge and the handle. This will aid the forceps to reach deep within the sockets to grasp the tiny pieces of roots. This is all what we have for the maxillary extraction forceps. Moving on to the mandibular extraction forceps. Also, these extraction forceps can be subcategorized according to the set of teeth they are designated to remove. The first part is the mandibular anterior extraction forceps. The differences between the maxillary extraction forceps and the mandibular extraction forceps is that the mandibular extraction forceps have a beak that's set to about 90 degrees to the handle. And also we have the hinge set in a vertical position rather than being horizontal. So the mandibular extraction forceps has a vertical hinge, while the maxillary extraction forceps have a horizontal hinge. The mandibular anterior extraction forceps can be used for the extraction of the 6 anterior mandibular teeth. It can be used for the removal of the canine, lateral, central incisors on both sides. So it can be used for the extraction of the 6 mandibular teeth. As we said, the beaks are oriented to about 90 degrees from the long axis of the handle, and the hinge is set to us in a vertical plane. The beaks of this extraction forceps is narrow, closed at the end to aid for the grasp of the 6 anterior mandibular teeth. The next part is the mandibular premolar extraction forceps. It's used for the extraction of the first and second premolars on both sides, the right and the left. Also, we have the beak set to about 90 degrees from the handle. The hinge also set in a vertical orientation, and the beaks, similar to the anterior extraction forceps, is rounded on both sides to accommodate a single-rooted premolars, but we have a slight spacing in between the beaks, while the mandibular anterior extraction forceps doesn't have this space when the handle is closed. So the premolar extraction forceps have, in general, the same shape of the anterior extraction forceps, except for having a slight spacing between the beaks to accommodate a wider premolar tooth. The third subcategory in the mandibular extraction forceps is the mandibular molar extraction forceps. This forceps can be used for the extraction of the lower first, second molars on both sides. The beaks also set to about a 90 degree to the handles. The hinge also set in a vertical orientation. And if we have a closer look on the beaks, we have projections or hook on both sides of the beak. This projection will aid for the engagement of the forcation entrance seated on the buccal and the lingual side of the molars. This extraction forceps can be used for the extraction of molars on both sides, as we have a buccal forcation entrance and the lingual forcation entrance on both sides. So the same extraction forceps can be used on the right and on the left. The projections, as we said, will engage the bifurcation to aid in a firm grasp of the molar during the extraction. The first variation for the mandibular extraction forceps, the mandibular third molar extraction forceps. This extraction forceps is one of the longest extraction forceps of the mandibular set. In fact, it is the longest one. This is mainly to allow reaching a more posterior position of the third molar that is located at the end of the dental arch. The differences between the third molar extraction forceps and the regular extraction forceps is the hinge is set in a horizontal position rather than being vertical, as we have seen in the conventional molar extraction forceps. The beaks, depending on the manufacturer, sometimes are rounded on both sides and sometimes it have a hook projection on both beaks to aid for the engagement of the forcation entrance if it is available on the third molar. So sometimes we have a rounded beak on both sides to accept a wide anatomical variation of the third molar. Some manufacturer might place a hook projection to give a firm grasp of the teeth that have a forcation entrance on both sides. In general, this third molar extraction forceps came usually with the rounded beaks on both sides. Another variation for the extraction forceps is the mandibular cow horn molar forceps. Mandibular cow horn molar forceps is used to extract the lower first and second molar on both sides. These extraction forceps can be aid in the delivery rather than complete the extraction of the lower first and second molars. It can engage the bifurcation during the extraction to laxate the teeth using the bone, the alveolar process, the bone on the buccal and the lingual side as a fulcrum during the laxation. As the name implies, cow horn, these extraction forceps have rounded, circular, pointed beaks on both sides that is specifically designed to engage the forcation entrance from the buccal and lingual side. It's best to use this extraction forceps for the delivery, for the laxation, of the teeth rather than using for the complete delivery. So in the beginning, we can use the cow horn molar extraction forceps for the laxation of teeth, and then we can use the conventional mandibular molar forceps to complete the extraction. Because these extraction forceps can laxate the teeth, but it doesn't have a firm grasp on the rooted trunk of these teeth because of the pointed, narrow beaks of it. If we have a severely carious lower molars, first, second molars, the mandibular cow horn extraction forceps can cause stresses at the forcation entrance and can be used for the sectioning of the mesial and the distal roots at the rooted trunk when we have extensively carious molars, when it's used in a controlled forces. All what we have is to apply this forceps, and then by pumping actions of our fist, squeezing the handle, we can either laxate the teeth or section them when needed. The last part of our lecture is the physics extraction forceps. This is a relatively newer innovations in exodentia when compared to the other conventional extraction forceps. It has a beak on one side and a silicone bumper on the other side. At all times, the beaks engage the palatal side of the teeth or the lingual side, while the bumper supports the alveolar bone on the buccal side. The physics extraction forceps is usually used for the luxation of teeth rather than extracting them. It can be used for the luxation of the teeth for about 1 to 3 millimeters out of their sockets, and then the conventional extraction forceps can complete the extraction. The bumper the silicone bumper is designated for a single use, and then it needs to be disposed after the extraction, while the forceps is a metal made of metal, stainless steel grade, medical grade, and can be sterilized and used again and again. Thank you for listening, and if you have any questions, you can post it on the chat. I'll be more than happy to answer them. Thank you.